Hey guys, welcome back to the Senior Care Conversation. I'm your host, Hilary Bailey. I am very excited about our guest today. It is Dr. Andrew Sun. He is a nationally recognized urologist and director of North Texas's largest sexual medicine clinic, a Harvard-trained physician with additional fellowship training from the Cleveland Clinic and UCLA. Dr. Sun focuses on helping men maintain sexual, hormonal, and reproductive health as they age. He is known for his patient-first, holistic approach to care. Hey, Dr. Sun, how are you doing?
Good. How are you? Thanks so much for having me.
Awesome. Yeah, absolutely. Welcome. So, one of the things we want to talk about today is, as we age, our bodies change and things start to not work as well anymore. So, can you give us some insight about why maybe that starts to happen as we age?
Absolutely. A lot of times we use a car analogy, and just like anything else in the world, as time goes on, things don't work quite as well. The fluids don't, swish as easily. You might have to like change some things out. Well, certainly when we're talking to guys about their sexual function, we basically use that analogy and say, look, things aren't going to work the same way they used to. Some of that is hormonally based for men and women. The hormone sort of profile changes as we get older. It's much more dramatic in women, of course, menopause and all the changes that brings. But even men will undergo a similar process, albeit a little bit more gradual. Some years ago, they came up with a term for this called andropause, trying to say that it's
Oh,
equivalent. It's not exactly the same. But there is a decline in testosterone levels in men as we age, roughly about 1 to 3% per year. These things can have a dramatic effect on energy, on mood, on sexual function, in addition to the actual physical workings of it as well when it comes to erectile function or things like that.
got you. Thank you. So I can imagine, especially like in my work, I notice that it's hard for people to talk about things like sexual health when they get older. How do you help patients feel comfortable in your office discussing things like this, personal health concerns that center around their sexual health?
Yeah, absolutely. Fortunately, I think things are generally getting a little bit better as a lot of advertisements online have started directing conversation about this. I think in like the 2000s when we had commercials on Viagra, that really kind of opened up a bit of a Pandora's box. But absolutely, it's still an embarrassing conversation topic for a lot of people, men and women included. I tend to find in my patients that it's sort of on the extremes. Either they're super shy about it or they're like super open about it. But the biggest thing that I want to reinforce with everyone is that there is no such thing as quote unquote being too old to enjoy sex. I think a lot of people when they come into my clinic, they're like, hey, look, I'm X age 50, 60, 70, 80. Maybe I'm just too old for this. And I just tell them honestly, you get to be the decider of that, right? There is no
Mm-hmm.
age at which sexual health is no longer relevant. Sexual health is as relevant as it is that you want it as you want it to be. And oftentimes it's actually a great indicator of overall health, especially on the male side, because let's be honest, men are not as good as taking care of themselves. They don't seek care as much. They don't go to the doctor as much. But one of the things that they do tend to notice and probably care about a little bit more is sexual matters. And oftentimes that can be a sign of other things going on. The same processes that cause erectile dysfunction, diabetes, high blood pressure, high cholesterol, these things are all important to your overall health. So it's a great marker of that.
Okay. So, why is it important to talk openly about things like bladder control or sexual health? What are some things that might be going on with someone in the senior community that might make them want to give you a call? Like, what are some signs and symptoms maybe to look for?
Absolutely. These are very, very significant quality of life issues that come up in both men and women. And I guess we could say the primary one is relating to the bladder. Just to break it down really quickly, all bladder physiology can be thought of in two aspects. There's the pump, which is the bladder, and then there's the outlet or the opening. And you can only have four problems: a pump that's too strong or too weak, and an outlet that's too loose or too tight. And it's basically different for men and women. And so as women age, it tends to be that they have more leakage or overactive bladder symptoms, especially if they have, multi-parent, like having a lot of children, because things just tend to loosen up a little bit. And so when women come in with presentations in older age, it's usually either recurrent urinary tract infections or
Mm-hmm.
leakage of urination when they cough or laugh or sneeze, or an urgency incontinence, which means they suddenly have to go to the bathroom and they have to run for it. And these things can have a pretty significant impact on your quality of life, your ability to go out and do things and live life normally. And on the male side, it's similar, but actually the opposite because men have a prostate. And so for men, usually the difficulty is that they can't pee. They pee slowly. They get up at night 4 or 5 times to pee. When you get up at night 4 or 5 times to pee, you're going to create a situation where you're not sleeping well. That can create sleep apnea. That can create sort of deficits in terms of how you're thinking, just being tired all the time. We actually think there's a significant fall risk getting up 4 times, 5 times a night just to go to the bathroom. You're stumbling around in the dark, and as people age, this becomes more and more of an issue. So the bladder is something that we take for granted when we're young, but when it starts to break down as we get older, things can go wrong pretty quickly. And so it's very important to kind of talk to a urologist about this because that's what we specialize in.
I love how you talked about how it changes their quality of life. I see this a lot in my work, especially my patients that we take care of in the home. A lot of times we see clients who get very dehydrated. Why? Because they don't want to have to get up and go use the restroom, or it makes them use the restroom too much and they do have to worry about that leakage, or they don't want to drink before they go out somewhere because they're worried they might have an accident. And gosh forbid they have to wear a pad or something. That's another thing about that affects their dignity. So for a personal question too, what's something that people my age and like maybe my husband's age, I know we can do some pelvic floor exercises, but what else can we do to take care of our sexual health, our bladder, things like that?
Yeah, in a lot of ways the two are linked because, if, for example, in women, one of the most common causes of urinary leakage is atrophy of the vagina that happens, after menopause. And why does that happen? It happens because of decreasing hormone levels, estrogen, progesterone, and testosterone. Although we think of testosterone as the male hormone, women actually still have much more testosterone than they have estrogen. It's just that the ratio is a little bit different, whereas men have way, way, way more testosterone than estrogen. Testosterone is important for both sexes. Um, the sexual part, of course, that's going to be very individual depending on libidos and things. That can change. We often, when we counsel, partners, just intrinsically having a low libido or low sex drive, perhaps it's not an issue. Having a high sex drive is not an issue. The issue is when a couple has a discordance between their sex drives, and one being very high and one being very low, and that can be hormonally based and something that we can manage. On the peeing side, for men, usually we advise that all men starting around age 50, although you could even say earlier, should start getting their prostate checked. Prostate checks include the good old-fashioned, finger poke up the butt, and we don't do that quite as much as we used to, but it's still a part of it. But a lot of prostate checking is just done through the blood. And so we have a test called PSA, which examines for prostate cancer, for prostate growth, and things like that. And on the female side, usually the symptoms will come first. UTIs, urinary tract infections, are much more common in women. If you're getting more than 1 or 2 of those a year, that's a reason to go to the doctor. And if you're having any sort of urinary dysfunction, fortunately, we have medications, we have surgeries, we have injections. People will probably be surprised that we can actually inject Botox into the bladder. And just like if you inject Botox in your face and it smooths out the wrinkles, it smooths out the wrinkles of your bladder. And if you have a hyper-reflexic bladder and you have to pee all the time and you can't go 10 minutes without going to the bathroom, things like that can be very helpful.
Yes, absolutely. So just for informational purposes, what is a good PSA level?
Yeah, so PSA is a blood test. A prostate-specific antigen is what it stands for. And basically, any number below 4 generally is considered okay. If you're really young, say 50s or so, you probably want it below 3. If your PSA is below 1, by the time you hit age 60, your lifetime risk of prostate cancer drops to 0.2%. And so it's really nice to have a low PSA. When it's low, we say, great, have a nice day. When it's high, it does not mean that you have prostate cancer. It just means that something is going on. And there's 3 things that can be going on to make your PSA go up. It could be inflamed or infected. It could be an enlarged prostate, which happens to just about everyone. The percentage of men with enlarged prostate is the same percentage as their numerical age. So 60% of men at 60, 80% of men at 80. And then it could be prostate cancer. And so the high PSA level, which is something that usually is checked every year by your primary care doctor, usually triggers a referral to a urologist for us to do a little bit more digging to see which one of these 3 things it ends up being.
Okay, thank you for that information. So at the close of this segment, I would love for you to share a story with us, maybe with a client that you had or a patient that you had, that their life really improved after coming to you and opening up to you about their issues.
Oh, there's so many, but there's one guy that stands out, and he was a former police officer. He was a former like championship boxer, actually. Most of his life was spent doing that. When he came to see me, he was probably early 60s, had gotten divorced, was quite overweight, and just feeling very down about himself and about life in general. Nothing was really working. He didn't have the energy he used to. We did a full sort of profile on him. He had some enlargement of the prostate. Part of the reason why he was tired is because he was getting up so many times at night to pee. So we put him on some prostate medication. Suddenly he's peeing better, and that part's fixed. But he still had very low testosterone levels. Low testosterone, yes, it does happen naturally with aging, but it can also be caused by being overweight and not sleeping as well. And so we put him on testosterone therapy. And, I really try to stress with patients, hormone therapy for many years has gotten kind of a bad rap. And testosterone, people always think about it from a bodybuilding standpoint, but it's a critical metabolic hormone that everyone needs to basically function. And so this guy's testosterone was so low that within 3 to 6 months after putting him in on testosterone therapy, he lost like 20, 30 pounds. He was back in the
Wow.
gym. He was showing me videos of him like hitting the punching bag again. He was dating again. Things were sort of working down south. He could pee easier, and literally, told me and wrote it on the website. It's like, I feel like I'm 30 years younger. And it's fantastic, and he's just metabolically healthier, and he's just doing so much better. Whereas if he never sought the care that we can provide, he would just kind of continue to be languishing. So those kinds of guys we have all the time. Fortunately, the biggest step is just to be okay to talk about it and to seek the care with people who can help, because there are things that we can do to help.
I love that success story. So, Dr. Sun, for our viewers who want to learn more or reach out to you directly, where can they find you online? Your website, LinkedIn, social media? What's the best way to get to you?
Yeah, for sure. So I practice in a large urology group in Dallas Fort Worth called Urology Partners of North Texas, or UPNT. And so you can find us on the website www.upnt.com. There are like 35 of us, but certainly based on what symptoms you have and whatnot, you can be directed to the best physician to treat you. And so that's probably the best way, or Google us or by our name.
Okay, great. Well, guys, we will be right back with more awesome information from Dr. Sun.